Hi, I'm Amanda. I'm going to be your nurse for today. Can I have you verify your name and date of birth?
Antonio Sager, July 16, 2002.
Okay, everything matches. I'm going to go wash my hands real quick, and then we'll come back for your assessment. Okay, I'm back from properly washing my hands, and I have my gloves on. Can you state if you have any allergies or on any medications?
No.
So no allergies to food, environment, or medications? And are you on any current medications?
No.
Okay, almost immediately you can identify that the patient is in no acute distress. They are sitting upright with a good posture. Okay, before getting started and checking your vital signs such as your heart rate, I'm just going to take a look at your nails and inspect them. And after inspecting, you can see that there is no discoloration or cyanosis and is regular edema of grade of 1+. After inspecting the patient's nails for discoloration and edema, as everything came back regular, we can go ahead and assess the patient for capillary refill on both hands. Capillary refill is regular with a grade of 2 seconds or less, stating that capillary refill and capillaries are working good. Now I'm just going to assess your heart rate by looking at your radial pulse, your brachial pulse, your dorsalis pedis, posterior tibial, and popliteal pulse. By doing so, I'm going to count for 30 seconds if it is regular, and if stated irregular, I will count for the full minute. Okay, after grading the radial pulse, after 30 seconds, it is classified as 32 beats per minute. And if you times that by 2 to get the full minute, you would get 64. Rating that as regular and a grade of 2+, stating that the pulse is regular, not bounding, or not weak or diminished. Now we will do the same with the brachial pulse, which is found right here within the arm. And grade that with 2 fingers, so that way your thumb is not intervening with the pulse. After 30 seconds, the pulse is also 32, which would times that by 2, which would get you 64. Regular 2+ pulse, which is also the same as radial pulse, which would signify as regular and healthy. Now I'm just going to have the patient lay down so I can test for any palpitations or pedal edema. Can I have you lay down, please? Now I'm just going to palpate your leg and your foot, your other leg, and your other foot. See that there is regular edema with a grade of 1+. After looking at the patient and palpating the patient's legs and feet, indicate that there is regular edema with a grade of 1+, indicating that there is no swelling or inflammation within the legs or foot. After assessing the patient's radial, brachial, dorsalis pedis, posterior tibial, and popliteal arteries, we can say that the patient has a heart rate of 64 with a 2+ grade, stating that the heart rate is neither diminished or bounding and that everything is regular. Now, after assessing the patient's heart rate, we're going to go ahead and assess the patient's neck for a JVD. By doing so, I will inspect the neck, see that there are no lesions or no discolorations. After inspecting the patient's neck, I will go ahead and palpate the patient's neck for symmetry. Everything is symmetrical as there are no visible palpations or lesions. Now I'm just going to go ahead and listen to make sure that there are no abnormal sounds with the bell of my stethoscope. Can I have you take a deep breath, please? Deep breath, please. And deep breath. So what I did is I assessed the patient's neck. I listened for abnormal sounds at the base of the jaw, the midclavicular, and at the base of the neck, and listen any abnormal sounds. I'm going to have the patient remove his clothing and put on dressing in private, so that way I will step out and come back so I can inspect his chest. To inspect, palpate, and auscultate the heart, IPPA, we will first inspect the chest and see that there are no visible lesions, no discoloration. Everything is symmetrical on both sides. Next, I will palpate the chest and listen for... Next, I will palpate the chest and view if there are any abnormal findings. And there isn't. Everything is symmetrical. There's no lesions, also no palpitations. Next, I will auscultate the patient's heart rate. By doing so, I will listen to the five valves with my diaphragm to begin with on my stethoscope. Everything sounds regular as there are no whooshing or swooshing sounds, indicating that S1 and S2 sounds are regular within the patient. There are no murmurs. Now I will repeat the steps of my auscultation using the bell of my stethoscope. Everything sounds regular as there are also no heaves or thrills, no swishing sounds, and no murmurs. After listening to the patient's heart rate, there are no thrills or heaves. Everything sounds great as it would be indicated as regular. There are no swooshes or whooshes, indicating that there are only sounds of S1 and S2 heart sounds, and no murmurs. Okay, do you have any questions or concerns for me today about your health or anything in general?
No.
Okay, thank you so much for your time. I'll see you next year for your yearly checkup.